Welcome to the Brittle Bone Society webinar, and today we're focusing on the ongoing relaxation of restrictions around the COVID outbreak. So thank you to everyone in the OI community for sending in so many relevant and good questions. But I'd also want to note, if I may here, that we had a number of inquiries from friends across the Rare Bone Alliance groups, from the hypophosphatasia group and fibrous dysplasia community, that's Soft Bones and FDDS UK. So what we've done is we've collated all of the questions, and we hope our esteemed panel can address some of your understandable concerns. So I'll go briefly to introductions. Delighted that we have with us today from Sheffield Children's Hospital, guest speaker Dr. Rebecca Jones. Welcome, Dr. Jones, clinical psychologist specialising in the paediatric area. And we also have Professor Nick Bishop, the UK's only Professor of Paediatric Bone Disease. Professor Bishop is also a trustee of our charity and serves also on our Scientific Advisory Board. And joining the panel, we welcome Dr. Kassim Javaid, Associate Professor from Nuffield, Department of Orthopaedics in Oxford. And Dr. Javaid is also Chairman of our Medical Advisory Board. So putting the questions to our panel today is our one and only Support Development Officer, Corinne Cody. So thank you for that, and I'll now hand you to Corinne.
Thanks, Patricia. Right, guys, I'll just start with going through some of the technical features. First, we've muted everybody's microphones, just so we don't get any background noise. If you want to ask any questions or you've got any comments as we go through this Q&A, just please enter them in the chat button at the bottom. We will try and get around to answering them. I'm aware Professor Bishop has to leave us at 3:30, so we'll maybe try and do a bit of a Q&A just in the middle if we have time before he leaves, okay? We are going to be recording this today as well, so we'll hope to get the recording up onto our YouTube channel either later today or tomorrow. Just so you're clear, the information in this session is just general advice. Needless to say, any specific individual advice, you need to go and seek that from your GPs or your healthcare professionals. So this is just general overview advice today. That said, just want to thank everybody for joining us. I'm sure you'd much rather be out in the sun. Thanks to everybody who submitted their questions prior to today. It's really useful to get a feel for what people's concerns and things are. I've had a few questions, queries, which weren't related to today's topic, so I've not included them in the Q&A. Because the surveys that were submitted are anonymous, if anybody does want to get in touch with me direct, please just feel free to email me, corinne@brittlebone.org. So that said, that's the introductions. We've had a few questions submitted to us, just general inquiries from people who aren't sure whether or not they should be in the shielding category. Some people still unsure about getting letters. We did cover some of this in the last webinar, but I wondered if either Dr. Javaid or Professor Bishop maybe want to just give a general introduction overbrief as to where we are, if there's been any changes since the last webinar, and just giving a general update. I can hand over to one of you. I don't know who wants to take that either.
Nick, do you want to summarise?
So perhaps if I talk about children first, and then Cass, if you want to jump in on the adults. I think what I can say about the risks to children generally from COVID-19 are that they are very, very low. And specifically, I know folk have been worried about if you've got chest deformity or you're very small, is your risk increased? And I think last time Cass and I went through this in some detail, and the advice and the guidance really is what we've got on the Brittle Bone Society website, which is that if you've got chest deformity that's resulting in you having smaller lungs than you should have for somebody of your age, or if you're on oxygen, or if you are receiving help with your breathing, like a mask attached to a machine that helps you breathe at night, then you should be shielding in those situations. That's what we've advised, and I think we're sticking to that. Having said that, when we look at what's actually happened with children, we'd anticipated at the beginning of the pandemic that we would see problems in children who'd got severe lung disease, such as those with cystic fibrosis. And so far, there has been only one reported case of COVID-19 in a child with cystic fibrosis, and that child was asymptomatic. So it hasn't affected children with lung disease in the same way that we had expected. There is no specific thing about OI or other rare bone diseases like hypophosphatasia, fibrous dysplasia, and so on, that seems to increase your risk of getting severe disease. So I think the existing guidance is sufficient. In fact, it may be, based on our growing experience, a little bit overcautious. I think the thing I would say, though, that for those of you who've got children with OI, if you are concerned about their health for any reason, please do seek medical advice. There is, on the other side of the coin, emerging evidence that a number of children have died as a result of not being taken to hospital in a timely fashion with illnesses that are perfectly treatable. And probably by the end of the pandemic, more children will have died or had problems as a result of delayed presentation than will have died as a result of the COVID virus. So that's on the pediatric side, that's what I would say. And Cass, you might want to now just update on the adult side.
Yes, pretty much reflecting what Professor Bishop has said, that what Nick has said, the advice is still the same. It's those people, and you'll know who you are, with severe chest wall deformities. It's not something you won't be aware of. They're the ones we're concerned that if you get sick with the coronavirus, that supporting your lung function may be more difficult and challenging. However, we are finding a lot more about this disease, and we understand now that it affects organs outside of the lungs. It affects many other organs. And so, as Nick has mentioned, there's no increased risk of that from OI or from the other rare bone diseases, which is relatively reassuring. The biggest risk factors remain. It's the elderly. That's a big risk factor, men more than women, and then those with pre-existing heart or lung conditions or diabetes or things like that. So our advice is still cautionary. If you do have these severe chest wall deformities, we do still recommend that you should be shielded, and you should have been contacted by now. We've worked with NHS England to make sure you're on the shielded register. The NHS wasn't great at recording who has severe chest wall deformities, because we've never been asked to record people that way before. But if you were missed, as we said on the Brittle Bone Society, you can self-register, and then your GP will write a confirmatory email or letter getting you on the shielded list.
Okay, great, thank you. So I think if we go on to some of the school-related questions. I've had a couple in relation to putting non-shielded kids back to school when there's still people in the household that are shielding. So I think maybe if we read out the next two questions first, because they're quite similar, and we can maybe just take them together, Professor Bishop and Dr. Jones as well. So the first one, my child with OI is in year 6, so may have the opportunity to go back before the end of the year. He's desperate to go back, and I think will struggle emotionally without school closure. He will also miss transition to high school lessons by keeping him at home. He doesn't have severe OI, so presumably is at no greater risk than any general 11-year-old. I, his mum, however, have got severe scoliosis, chest wall deformity due to OI, so I've been shielding. The government advice is to shield until the 30th of June at the moment, but we're expecting this to be extended. We're trying to decide whether it's worth sending them back for at least a few weeks of term, but I've always concerns about bringing them back into the household. And similarly, if the shielding programme is extended, what should we do about sending our non-shielded children to school?
Okay. So the current guidance is that if you've got someone within the home that needs shielding, then they need to be protected from anyone who's coming and going from the home. So if you as a parent need to be shielded, then you are going to have to put in place measures at home to ensure that you are shielded within your home. And that is pretty tough if it means that you can't then have regular contact with the children. But there's very clear guidance in the government publication on shielding and protecting extremely vulnerable persons that's available on the website, on the government website. I'm not sure, Karine, whether we've got a direct link to it, but I've put it into that
I can get that
I sent, so we can put it on later.
Yeah.
It's a horrible situation to be in. And I don't know if Rebecca wanted to comment any further about that side of, you know, the emotional and mental well-being side of things. I think it's a really difficult situation to be in. But that's how it is. Whilst we believe that children probably are less affected, well, we know they're less affected by the virus. We think they are less likely to transmit the virus. They don't seem to develop such a big viral load. Nevertheless, if they get it, they can spread it. And they can be asymptomatic, so it's very difficult to know whether they have or they haven't got it. Okay, I think I'll stop there. And Rebecca, I don't know if you want to say anything about the mental well-being aspects of that.
Yes, it's a very difficult situation to be put in, and very anxiety provoking. And I think it's totally normal and expected to be really anxious about these decisions. And I think one of the things that has made these decisions so difficult is that the government has given permission to parents to make the decisions themselves. Sometimes when we're told what to do, it's easier. And so when you make a decision, you have to weigh up the risks, and we all have a different set of circumstances. So you weigh that up in line with the guidance that is being given, in line with medical evidence. And for some people, they'll be weighing that up, you know, in their own tolerance of risk. And it's all right to make a decision now for the moment, and then say maybe in a couple of weeks you'll review that decision. And that might be one way to cope with this difficult time, would be to say, right, well, we're going to do whatever it is we decide now, and in a couple of weeks we'll review and see what the evidence says then, find out where things are at, and make the decision again at that point. And that's very hard when you've got a 10, 11-year-old saying, well, I want to do this or I want to do that. I think one thing to bear in mind is that many parents are making that decision as well, and there are many people choosing not to send their children to school, as well as many people choosing to send their children to school. And there are also children in years who are just not getting the chance to go back right now. So it is difficult, but it's okay to make the right decision for your family. And I think just reassuring yourself that you're not doing anything wrong. There is no right or wrong necessarily in these circumstances. And reassuring yourself with the fact that there will be many other children in your child's year who won't go back, as well as children that will go back. And there'll be children that go back and have to isolate after a few days for one reason or another. And so lots of children will miss quite a lot at the moment, and they will get over that, even though it feels so important right now.
Okay, yeah, thank you. And I will get that link up after this, so you can check that out on the website. Similar question, so that was related to putting non-shielded kids back to school when you've got shielded people in the house. But the next one, my child is severe type 3, he's in reception year. I would like him to go back to school, but I'm unsure whether it would be safe for him. We live in London Borough, which has had a high risk rate of infection. Obviously concerned about putting our type 3 back to school.
I think that one's for me. So it's a very straightforward answer. If the child, if he's otherwise well, he's not having ongoing treatment for any chest problems, then as far as we can tell, his risk is no higher than that of any other child. And so you should look at not being any more risky for him than it would be for other children. But bear in mind what Rebecca has just said about, you know, it's your decision at the end of the day, and there is no right or wrong. You can make a decision and then you can revise it if you want to. But there's no specific medical reason or medical risk as far as we can determine at the moment.
Great. Okay, so the next couple of questions are really just about going out for walks. For those with type 1, pigeon chest and who have a flu jab and are on SOL, are they okay to go back to school or go out for a walk? That's from a parent of 2 children with type 1. And similarly, my whole family is shielding due to my scoliosis, chest wall deformity. What is the opinion of the panel as to how safe it is to go for a walk if we social distance, the kids especially, but all of us would benefit from this from a mental health wise and basically.
So if your whole family is shielding because of your problems, then the same thing applies that we discussed before, which is you need to be shielded, and if they go out and are exposed, then you need to be shielded from them. But for those who are, the first bit, for those with type 1, pigeon-chested on the flu jab and so on, I think pigeon-chested isn't a very severe deformity that would make me worry about issues, and I think I would be quite happy for them to go back to school or go out for a walk.
Thanks. Dr. Jones, I don't know if you want to come in about any of that and just sort of well-being about going out for walks and exercise.
So it's really hard to stay you know, upbeat and positive. I think nobody is really. I think the reality is that you'll have good days and bad days through this, and I think doing what you can for your well-being is really important. So if you can go for a walk and that is safe to do, then that is a good idea. Fresh air helps, but there are other ways and things you can do which help look after your mental health, and routine is particularly important, especially for children. And if they are in a better routine and more contained, then it will be easier for parents too. So keeping routine and maybe building into that something nice to look forward to each day. One family recently told me about doing a project, and each week they have a different country and they watch a program on it and they eat some food from it and listen to some music, and that sort of thing can actually be quite helpful, just for keeping everybody's spirits up. And you could do that even if you were on your own. There's nothing wrong with that. I think giving permission to enjoy yourself at times and plan that into your routine is very, very beneficial for well-being, as is going outside if you can do that. But I think if going outside creates such a high level of anxiety that it almost cancels out the benefits of being in the fresh air, then it would probably be better to open the window and plan a nice activity on a regular basis in the house.
Yeah, great, thank you. Okay, so this is the last question I've got, which is sort of related to children. If anybody does have any questions that they want to pose towards Professor Bishop or Dr. Jones, you maybe want to put them in the chat now, because I'm aware Professor Bishop's only got about another 5-10 minutes with us. So this question is kind of more aimed at employers. I'm a primary teacher due to return to work from maternity leave towards the end of June. My son's type 4, mild to moderate OI, no chest deformities that we know of. My concern is that with the current government advice to schools, social distancing is going to be impossible, and I'm going to be working in close proximity with small children. I'm terrified of bringing the infection home. Is there anything I can say to my employer? He's technically not in the shielding group.
Very simply, as far as we can tell, he should be fine. And there's no point in my sort of going on or on about it, because I said the other things before already. But he's not at any increased risk as far as we can tell compared to other children. So you should be okay to go to work and come home. If you do bring the virus home, then of course other people in the family can get it, but it's not going to be worse for him than it would be for other children, I don't think.
Okay, great, thank you. I don't see any particular kids-related questions yet, but if anybody does want to put them in the chat within the next 5 minutes, we will try and get round to answering them.
Corinne, sorry to interrupt.
Yeah.
Can I add something onto that question about
Absolutely,
going back as
yeah.
well? I was just thinking it's quite hard returning to work, and especially if you're returning to work after maternity leave, that would be a really normal time to feel quite stressed. Actually, it's very, very difficult. So I think anticipatory anxiety, which is the anxiety we get before we do something that frightens us, can be very acute and very difficult to cope with. I think the reassuring thing is once you actually do it, it does actually go away. And from what we're finding out through the crisis that's been happening is that any professionals having to work outside of the home, or not any, but most, have had anticipatory anxiety. And that was quite acute at the start for some people, but it has tended to subside over time. So that doesn't necessarily answer a specific person's question, because everyone's situation is different. But if you are in the situation where you're being asked to return to work right now and feels like that is a risky environment, it might be worth, if the medical evidence is that there isn't any greater risk to you than anyone else, just recognizing that it's actually okay to feel really, really awful about it, and that is a very normal response. Sometimes it's about just acknowledging that and then moving to the next day and seeing if you can just get through a little bit at a time. If it does get too much and the anxiety is too great to bear, that is also important to recognize, and that is something that it's appropriate to talk to your employer about.
Yeah, that's a good answer. Thank you. Thanks for that. Okay, so this is adults really, and just normal daily activity. Please can you advise what your best advice would be for people with OI type 3 to resume with normal day-to-day activities? It's very clear the virus is likely to continue for some time before a vaccine or any other treatments becomes available. I believe we're at risk of catching pneumonia, staying in alone, and overall it's no good for our state of mental health. Dr. Javaid, I think your microphone's still turned off.
So that's a tough one. If for adults with type 3 with severe chest wall deformities, they do fall into the shielding category, and that has to continue. And as Rebecca has mentioned, it's really important to address these sort of concerns people have. It's always a balance between strategies you put in place to lower the risk of getting the virus and the side effects of the actions you take. You could end up taking it too far. I mean, from my limited experience, people with rare bone disease are sometimes quite used to being by themselves for some time, and often have quite good psychological strategies for this. I think it's at the moment is wait for the advice. There are vaccine trials underway. We are finding new drugs to treat the condition, and so there is maybe some light at the end of the tunnel. This isn't going to be an extended forever situation, but right now, I suppose my advice would be to follow the shielding advice and just to hold on for a bit longer, because there may be some advances in how we risk stratify people as more evidence comes out, so we can more carefully select those who really must be shielded, or as the expertise grows in treating the virus, we can say, well, you may get the virus, but the feared complications are much less likely to happen.
Yeah, okay. This next question is fairly similar, but I will ask it anyway. I've been told that I can't leave the house until the 30th of June, and then only when my GP says I can after that date. My husband would like to start going out for local walks on his own. Would this compromise my safety?
I think the shielding advice is quite strict. You should restrict yourself to only essential visitors for healthcare, and not leave the house unless absolutely essential for medical care. I just want to reiterate the point that Nick made, that if you're sick, you should seek medical attention. Just as is in the children, in the adults, there is a concern that people with heart attacks or strokes, who would be perfectly well managed in the hospital setting, the fear of going into hospital is actually making their sort of health worse. And the restriction is to avoid non-essential visits. And if you have a health problem, that's an essential visit, and you should follow the usual NHS pathways.
So the next question we actually got from the HPP community, not directly related to relaxation of restrictions, but I thought I would leave it in, especially on a nice day like today. Can all this lovely sun we are having help in any way? And if so, is it worth investing in a UV lamp?
Sunshine's always good, but you don't have to invest in a UV lamp. I think this question may be indirectly related to vitamin D, which is for which there is some basic guidelines that you should be at least on 400 units a day of vitamin D. But to be honest, with this amount of sunshine, if you don't have darker skin, it should be okay. Most people don't dip to low levels of vitamin D if you can get sunshine. I wouldn't recommend UV lamps. There can be side effects of too much UV on the skin. And there are quite good sunshine rules of going out before you burn, and that are there for your safety. And it's always a balance of the risks and benefits of anything.
So the next question is about the NHS letters. I've just been sent a shielding letter in the second round for Wales. This means lockdown until August, after 8 weeks already. Do you think if restrictions are lifted in Wales, I could start doing things again, or have I really got to do another 12 weeks?
So say that again. They've already been shielding for 8 weeks.
Yeah, and now they've just got a second letter saying that they have to shield for 12 weeks as of the date of the letter, I assume.
I'm not quite clear. I think the shielding thing, just you have to follow the letter. If the letter says you have to shield till August, you have to shield till August. These are very conservative measures, but I think we've all seen what happens when countries lock down early and lock down hard, and I think that we have to follow the advice to try and keep that, as some of our leaders have said, keep the lid on the curve and make sure it doesn't come back.
Okay. I then got a few inquiries about vaccines. I think I'll just ask the three of them, Dr. Javaid, and then we can maybe answer them together. I'm a moderate OIR, previously thought to be type 3, but after having taken part in the 100,000 Genome Project, I've been found to have a unique mutation. I've been pronounced kyphoscoliosis and significant chest deformity. I live alone and I've been shielding for almost 9 weeks. Once my prescribed period of shielding is over, will it be safe for me to go out if no vaccine is available? I live in a relatively quiet market town. However, I do use public transport frequently. And then another one, any updates regarding vaccinations? Will we ever get out of shielding before a vaccine is made? And if a vaccine becomes available, how safe will it be, considering most vaccines take years to get to trial? Should those of us with small stature be given a child's dose?
I suppose I'll take it in reverse. There are trials going on with vaccines, and if they work, they'll have all of those sort of dose adjustments as you need. I think the way the regulations work, the vaccines will only be made available if they are safe. And I think you have to balance that. At the moment, we only have one treatment that can be used for people with COVID infection, and that treatment isn't super effective for people who are very sick. So we are facing an illness that has no real golden bullet treatment. So vaccines may be important. In terms of what happens after shielding, I think we just have to wait for the government advice on that. As the summer progresses and the number of people with the infection go down, then the test and trace system will come into place, and that will also be an important part how the country responds to the virus. So we won't only rely on shielding, we'll also rely on test and trace. But I think we just have to watch this space and see what the Public Health England say at the end of June. Nick, do you have anything to add on that?
No, I'm just typing a message to everyone saying I have to go now to my
the
meeting.
I thought I'd catch you before you left.
Yeah, I think the test and trace system when it comes in. It'll start in one way, it'll get refined. I think more testing will happen in due course than there is to start with. And as they get their heads around how quickly they can get the tests back and what the optimum delay between getting a contact is and then being tested. Okay. Take care, everybody.
Thank
Bye.
you.
Bye.
Thanks. Okay, yeah, and the last question I've got is, do we know why some people go into phase 2 of COVID-19 and others don't? Do those with severe eye scoliosis, chest wall deformity have a greater chance of moving to phase 2, or is the same chance as everyone else to get to phase 2? And is it harder to recover from?
I assume phase 2 means a more severe part of the disease. Is that?
I think so.
Yeah.
Yeah,
So,
I wasn't 100% sure on that question, but I assume
yeah.
so.
So at the moment, we're just guessing. We're making some assumptions that if your chest and your lungs aren't normal to start with, you're more likely to have severe complications. And that is actually substantiated with some evidence. We now know with pretty good certainty that people who have chest damage from other diseases, such as smoking, are at a much higher risk of getting severe COVID. Now, whether that's the same as someone having severe chest wall damage from OI, we don't know yet. But as Professor Nick Bishop said, there haven't been cases to our knowledge of that. And we have quite a tight-knit community that can report into this. That would be my answer, really, Corinne.
Yeah, okay, great. Well, that's the last of the questions I've got. I do see that we've got one question in the chat.
I can see 3.
Oh, so 3.
4. I can
Sorry,
see 4.
I've only been getting. Okay, yes. Well, we just go through some of them.
Yeah, sure. So the first question is about OI with no lung issues and having another rare disorder called hypertrophic cardiomyopathy. So the OI by itself, unless you have severe chest wall deformity, and you'll know that, doesn't increase the risk. I'm not an expert in cardiology, but I went onto the websites, and there's 3 types of people. People who aren't at increased risk, those who are extremely vulnerable, and this is what we mean by chest wall deformity, and those who are vulnerable. And it puts the hypertrophic cardiomyopathy in sort of the vulnerable list, so not the shielding list. But I would always say, get in touch with your cardiologist. It depends on the severity of the cardiomyopathy. And, this is a time when you need to contact your hospital team to ask for their advice. Usually you can find an email on your clinic letter that you can write into, or you can actually write to the team. Sometimes telephoning hospitals at a time like this isn't great because many people are off and the backup support isn't there. But if you email your consultants team, they should get back to you within a week or so.
Can I just come in on the bit about the children returning to school in that question? I was
Sure.
just thinking that often as parents, you make a decision in the best interests of your children, but sometimes what is in the best interests of your children will actually be to look after yourself. And that's a very difficult position to be put in. And it will create guilt, and that is understandable. And I think acknowledging that to yourself, and but that you're not alone in that, there will be many people feeling the same way. And I think one thing that will be important, not in relation particularly to this question, but to people making a decision about their children returning to school, is not to let the children make the decision. So there may be a temptation with older children to discuss it with them and get their opinions, and that is good, to talk to children and listen to what they have to say. But it will be very important to make the decision as parents, so that the children don't feel they have a responsibility, and so that if they were to go back to school and get unwell, and an adult gets unwell, they don't feel responsible for that. So I think listening to their thoughts, but then telling them that parents are making the decision, and that's that really is okay in this situation, because it is a really difficult position to be put in. And I think there's some reassurance actually at this point in the year of saying, well, 6 weeks or 7, maybe 7 or 8 weeks of term left, and then it will be the summer holidays. So whichever decision you make right now won't be terrible for the children, and there'll be another opportunity to make that, and you could change your mind halfway through the term if necessary.
Thanks for that. Yeah, do you want to take the next question? My latest text from the government said we should be shielding until the 30th of June. Do we expect there to be an extension?
Unfortunately, I'm not very good at predicting what the government says, so I don't know. It was a slightly flippant answer. From the science, we know that the virus will become less active during the summer, but what everyone's concerned about is the second peak. And I think it's really a test or an analysis to see how the test and trace system works, and whether we can really use that to lock down the virus would be the real test of how we go forward. It's a changing situation. It's a bit unsettling. We can't predict what's going to happen, but we just have to be responsive. And as Nick and I have always said, just keep in touch with whatever broadcasts they're doing, the daily briefing, and also keep in touch with your hospital team if you have any questions. I would add to Rebecca that try not to watch too much news. I would limit it. We know it's a tough situation, and there are strategies in your routine. They only check your phone once or twice a day to see what's happening, rather than have it buzzing all the time whenever something's announced.
The next question is from someone with HPP. Kind of answered this, I think, in one of the previous questions, and Professor Bishop's gone. I think we would just leave that one.
Yeah, so that's you know, if you're shielding, you're shielding, and that's what it is.
There's another one here from Penny. On our letters it says call 111 as soon as we get symptoms because we're shielding. Is that the case, or should we wait until we feel we need to go to hospital?
Yeah, so the 111 has an online system as well as calling. So I think you should call them, because one of the unusual things about the virus is that some people are presenting quite late, or actually they're quite sick. And if you're concerned, I would just get in touch and get that reassurance, so you know what's happening. For some reason, people can get quite low oxygen levels without really having much in the way of symptoms, and you know, you need to be careful you don't miss and come in too late.
Thanks. The next one's about a child, and obviously Professor Bishop's gone. But my daughter, type 3, is due to saldronic acid next week. Should be going to hospital or defer treatment. I guess that's the case of speaking to the consultant.
Yes, in adults we're very much relaxed. In adults, zoledronate works in a slightly different way and is a very sticky drug. So in adults, we're happy to defer. I know that in Oxford, we're just restarting our zoledronate service. And if they do invite you to come into hospital, you can be assured there'll be a strict policy, and you will literally come in, have the infusion and go in the safest way possible. So I would trust your local NHS to deliver a pathway. I know where we are, there's been extraordinary changes to how people are managed now. So when people come into the hospital, there's a very strict pathway. It won't be like before, where you're walking into a foyer full of people that you may catch things from. It will be a completely different system when you go in to have your infusions. So when you do ring up and you are concerned, just bear that in mind. It will not be the same way as it was before the pandemic. There will be a much more structured and safe way to get you from the car into the infusion and then back out into the car with as little contact with anything that could possibly give you the virus.
Okay, so the next question from Joanna. My consultant felt going out for a walk might be a very low risk of catching anything. if you're somewhere quiet and social distancing. She didn't say it's okay, but she did say it'd be okay to go out as a family. Joanna's not really asking if it's okay to break shielding. She's just basically saying how
Yeah,
low risk is it to go out for a walk.
it is low risk because you have the air, and this is an airborne or a surface spread illness, so it is much lower risk if you go outside. So that we know that. I have nothing more to add on that. It's you get outside, and it will do your mental health a lot of good. And it's actually been encouraging seeing so many people walking outside rather than at home.
And finally, I think this last one's more of a comment. I was told that unless
Yeah.
we were contacted to say treatment was cancelled, then we should go into Sheffield as Mason when we attended there with my son, and the process was so much quicker. That's just a general comment to end on.
Yeah, so as I said, the systems have changed. So you are going to be going into a different NHS when you go in for your infusions. So any concerns you may have had from previous visits for pamidronate or zoledronate, it'll be different now. It'll be a lot safer, and they will only invite you in if they're happy with that.
Can I maybe just ask a quick question, Dr. Javaid, and this is just wanting you to get your glass ball out again, but how long do you think, like, have you got a general feel for how much longer these restrictions will go on for within the NHS? Are things starting to get back to normal at any?
Yes, they are. So we are starting the hospital. It's very dependent on which hospital you come from. The virus has affected different parts of the country very differently, and there are some areas which are still have quite a lot of people coming through, whereas others there's a much lower level. But the hospitals are now working out how they operate in what we call the new normal, and it'll be a lot more non-face-to-face contact. So that's jargon for telephone consultations and video consultations. That has huge challenges. I'll just speak from the adult side. Telephone consultations have limitations. Simple things. If you know you're expecting a telephone consultation, you will be phoned from a barred number. So if you have barring on your phone, we won't be able to get in touch with you. For video consultations, I'm about to do my first one next week. It's going to be about how reliable the internet is. But if your consultant has selected you for a face-to-face contact and you're worried, you will not be going into the usual clinic setting. They have set up a COVID-safe pathway for you to have a face-to-face consultation. It does mean that the wait for face-to-face consultations will grow, but we're actually finding we can almost have everyone have a telephone consultation, and based on that, we decide who has a face-to-face. So that is happening, and it's starting. It'll be completely different. The waiting room will be empty. You'll wait in your car, and then we'll tell you when you can walk straight into the consulting room, and then you'll be escorted out. There'll be temperature checks as you go in, questionnaires to complete, and if you're any symptoms that could be virus related, you won't be allowed in, and you'll be asked to be tested. So it has already restarted. It will be clunky. We are learning. Bear with us. It's a totally different way of working for us. There are opportunities now, and we are working as a group to see how can we work more with video conferencing and telephone consultations, because often as the adults, having them to drive for 2 hours, wait an hour in the car park in Oxford, and then have a half an hour meeting with me when most of it could be done on the telephone is a remarkable thing. And it's also shone the light on the psychological needs of people, which I think has been really hard for us as clinicians to fight for. But we're hoping that this has really highlighted that aspect of care. Maybe Rebecca could comment on that, but it's really been good for us to see the mental health so highly prioritized in the care of patients, rather than being at the end of the list. It's equal. Physical and mental health are important, and we just hope that continues as we unwind and unlock, and we have those support services in place.
Yeah, I think I mean it's very important that psychological health is always recognised. I think it's important for people to know that mental health services have continued and are continuing through this, and that it would be completely acceptable to contact your GP and need a referral at this point, and services are still accepting new referrals. The psychology service at Sheffield Children's Hospital has been operating throughout, but often in a remote way like this, but that has actually suited some people quite well. Obviously everybody experiences it differently, but it's very important that we recognise it, and I'm really glad to see it talked about more, that we all have psychological health all the time, and sometimes that means that it's helpful to talk about it, and in fact actually everybody needs to talk about it. So it'll be really good if an outcome of this is that more support is provided, especially in adult services as well as child services, where I know we're quite well resourced in comparison.
Thank you. Okay, well, I think if there's no more questions from anybody, I think we've covered everything. And it just remains to say thank you very much to Dr. Javaid and Dr. Jones, and obviously Professor Bishop, who's no longer here. But yes, thank you everybody. Thank you for joining us. We do hope to run more of these type of webinars, so it's great to get any feedback from you, and please just email me with any questions. And thank you.
And I'd like to thank the Brittle Bone Society and Patricia and Corinne for their amazing work in nudging us healthcare professionals to keep going. Thank you for your support and being the glue that keeps us together. Thank you so much.
Yeah, I think we all keep each other going, don't we? No, thank you guys, and
Thank
yeah,
you.
Thank you.
enjoy the sunshine.
Bye-bye.